Hello, so welcome to part 14 of toxin sequestration theory. This is my new theory of cancer. It's based on the research of MIT professor Stephanie Seneff, as well as other people like Tom Cowan and Agenas Vonderplanitz who've had the same idea before. I've built on this and extended it in many different ways. This idea is that cancer is actually not a disease. It's the body's defense against toxic overload. It's the way that the body stores and processes toxins, so it creates a tumor to sequester toxins away from healthy tissue and store them for safekeeping or process them and detoxify them. It's very much similar to how the liver works because the liver serves that same function. So sometimes I think of cancer tumors as kind of like the body's second liver. And sure enough, liver damage can precede or trigger the formation of a tumor. And we've talked about in this series many different examples of toxins that are stored by cancer cells, things like heavy metals, iron and copper, as well as oxalates and fructose and glucose, the sugars, those are pulled in by cancer cells. The classic toxins, ethanol, drinking alcohol, as well as cigarette smoke, those are pulled in and processed by cancer cells. Mycotoxins, which are mold toxins, as well as more recently we talked about microplastics, PFAs, the forever chemicals, as well as AGEs, advanced glycation end products. And in all those cases, the story is the same, and that cancer cells will typically upregulate their transport mechanisms to pull in these toxins. So it's not accidentally that those toxins get inside. They're actually pulled in. And then once they're inside, they're either stored for safekeeping, like in the case of heavy metals and copper and iron, and oxalates, or they are processed, like in the case of ethanol, cigarette smoke, estrogen, and fructose and glucose. They're detoxified. So that's basically the idea of how cancer works. We've also talked about how cachexia and metastasis are late-stage defense mechanisms, similar to cancer itself. And in this discussion today, I'd like to talk about surgical removal. So one of the most common questions I get from people is, should you actually remove a tumor? Should you get surgery to get it removed? And of course, this is a very sensitive topic. Everyone, would have their own opinion, and I just want to be clear that I'm not here to give people medical advice. Everyone has to make their own decision. So the only thing that I can do is give you the predictions of my theory. I can say, well, if my theory is right, then this is what it would predict, right? And then you can take that information for yourself and use it how you wish. Based on what I've told you about toxin sequestration theory, I'd like the audience to just take a moment and think and pause. So what do you think you should do? Think about it, and please leave a comment about what you think the right thing to do is. Should you have a tumor surgically removed? Is it a good idea or not? Now, from the mainstream perspective, cancer is malignant, it's uncontrollable and selfish. So they're like full steam ahead, surgery, 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 right? Cut it out, right? Surgery first, think later. And that's their attitude. And they think it's basically just, there's no dilemma, there's no caveats. It's just like full steam ahead, go with surgery. Never mind the fact that surgery can have complications, unintended complications, right? You can accidentally cut an important nerve or artery or some other tissue that's super important by accident. So any surgery is always risky, and things can go wrong. With that said, what I'm going to talk about today is kind of a nuanced answer to the question, presenting the fact that there are certain cases where surgery can be beneficial and other cases where it might not be. And this is, just to be clear, I've been getting this question for weeks and weeks, but I've hesitated from publicly stating an opinion because it is a subtle answer. It's not cut and dry. With things like, chemo and radiation, my opinion is cut and dry. It's very clear what my stance is. But with surgery, it's a little bit nuanced because in theory, a tumor contains toxins. It's storing microplastics, PFAs, oxalates, heavy metals, including the iron and copper, and other toxins. And so all those toxins are stored for safekeeping inside of the tumor. Now, wouldn't it be nice to have that out of your body, right? So the benefit of having surgery is that you remove the toxins that were being stored in the cancer tumor. Now, you could make the argument, of course, that, well, this cancer tumor had it sequestered anyway, so it wasn't really bothering your healthy tissue, and that's the whole point of sequestration. And that's a valid argument. Nevertheless, it could be possible that some toxins might, every once in a while, accidentally leak out. So it is reassuring to get those toxins out. So I just wanted to sort of play devil's advocate and say, well, there is some legitimate aspect to surgery in the sense that you are pulling toxins out of your body. And the flip side, however, is that I have cast cancer tumors as a detox organ, meaning that whenever your current detox organs are not doing well, if your liver and your kidneys are struggling, then you need extra help. And so there may be situations where your primary detox organs are not doing very well. And if you do remove the tumor, that's like removing your new detox organ, the detox organ that your body built to pick up the slack for your struggling detox organs. And so that's the flip side. And that makes things complicated because there's all this infrastructure that the body invests into building a tumor. It builds new blood vessels to send the bloodstream to the tumor so that the tumor can process the toxins and store the toxins, and so that it has access to the toxins. And similarly, the body builds infrastructure to physically and mechanically support the structure of the tumor. So when you remove the tumor, the body's like, well, you just basically undid all the hard work that I did, right? I put all this hard work into building this nice sequestration system, and you just, took it all out. So that's the flip side. So we have the pro, which is that you're getting rid of the toxins. We have the con, which is that you're removing the body's second liver, like its detox organ, and now the body's scrambling to figure out how the heck it can detoxify toxins. That's the dilemma, and that's why the answer has to be nuanced for surgical removal. So what I'm going to argue is that there's a certain set of guiding principles that my theory would predict for surgical removal. And the first one is that not every tumor necessarily needs to be removed. It's not mandatory to necessarily remove every tumor. And number two is that it can be beneficial to surgically remove early stage localized tumors that are small, tumors that aren't spreading rapidly, aren't growing rapidly. And that's where, for example, skin cancer is a really good example. Many skin cancers are small and localized to a small region of your body. In those cases, it can be beneficial. However, some tumors are actually low risk and stable and slow growing naturally, like many early prostate cancers. And in those type of cancers, the body can safely maintain them for years under active monitoring. And surgical intervention might appear unnecessary for those kind of slow-growing tumors that often appear, say, in the prostate. And then at the other extreme, so in advanced stages, if you have widespread, say, metastasis, or your tumors are highly malignant and they're growing rapidly, malignant is in quotes, of course. Malignant, by the way, just means that the toxicity is widespread and that the tumor is growing rapidly. In those cases, the tumor frequently acts as the body's primary sequestration system or the primary detox organ. Chances are in those cases you have probably damage to your primary detox organs. Your liver and your kidneys are struggling. In those advanced cases, aggressive removal of the tumor can backfire because unless you substantially reduce your toxic load, if you're still dumping toxins into your body, then you can be left with a toxic situation without a detox organ. That's not a good situation. So I'll back all these statements up with actual real medical data. But the basic message is that surgery is best used as a strategic tactical tool rather than a blanket cure. Okay, so let's dive in first to the early stage case where you have, say, like a small localized tumor and it's not rapidly growing. This is a case where surgery can be helpful or beneficial. And like I said, skin cancer is a good example of this. And there's a lot of data suggesting that, in early stage skin cancers, removing a tumor leads to good outcomes. So, why would you want to remove a tumor in, say, early stage cases? Well, you could reduce the immediate mechanical pressure on the surrounding tissues. You could lower the risk of local complications, buy valuable time for the body to lower its overall toxic load through diet and lifestyle. And, you would prevent the storage vault from growing much larger. So in that sense, from the body's perspective, when the tumor is highly localized, it's just like a little emergency storage vault that is not necessarily acting as like an actual organ. It's just literally a small storage vault. And everything is well contained and well localized. And the body has not, at that stage, invested tons of resources into that tumor, right? It's not the primary detox organ. So when you remove this, basically, it reduces the immediate pressure on the body and can buy you time to lower your overall toxicity. And like I said, on the other extreme, we have advanced or widespread disease. This is where removing the vault can backfire. Now, the tumor is no longer just a small emergency vault. It has become the body's primary sequestration compartment. And the toxic burden from microplastics, PFAs, seed oils, iron, heavy metals, AGEs has grown so high that the liver and the kidneys can no longer safely handle it on their own. So at that point, when you remove the vault, it can leave the body with nowhere else to safely store and process these toxins. So that's a concern. And like I said, from my theory's perspective, when you remove the tumor, now the body suddenly loses its largest toxin sequestration site. And circulating toxin levels can spike as the stored material is released or no longer contained. The remaining detox organs are already overwhelmed, leading to faster damaging of your vital tissues. The body may even respond by trying to build new vaults, metastasis, even more aggressively, right? Because you remove the primary one, so the body's kind of scrambling to see if it can build a new one somewhere. So, this is why some patients experience rapid, progression of their disease after a, successful surgery whenever their disease is late stage. So even if the surgery is quote unquote successful in removing the tumor, some people will still get, worse outcomes in these late stage diseases. And so just to recap, late stage surgery is not automatically beneficial. You have to weigh things carefully and really think about your other options. And you have to think about, did I do step one? Step one is always reducing your toxic load, right? Surgery should not be step one necessarily, right? Step one is reduce the intake of toxins. So let's think about like a kind of practical decision framework. When should you remove the vault and when not to? So like I said, surgery is more likely to be helpful when the tumor is early stage, small, and localized, and the overall toxic burden on your body is still moderate or being actively reduced through, say, a keto diet or carnivore style diet or lifestyle changes, right? So whenever you are working hard to do your part to lower your toxic burden, then it can make sense to have a small early stage tumor removed. And it can also make sense, of course, if the vault is causing some mechanical problems, like if it's obstructing some key part of your body or compressing something. And also, it can make sense whenever there's still good function in your primary detox organs, the liver, the kidneys, and the lungs. Whenever your primary detox organs are still working well, then it can make sense to have a tumor surgically removed. When it does not make sense, or when it requires more caution, is whenever the disease is advanced or metastatic and the tumors have become the body's dominant sequestration system. In this case, you may have not yet made significant progress in lowering the underlying toxic load. And if you haven't made progress on that, you have to think very carefully. And also, if the patient is heavily compromised in terms of damage to their detox organs, right? If your liver and kidneys are struggling or failing, you have to be very careful about removing your emergency detox organ, right? Your tumor. Right. So those are the basic ideas for how you can potentially think about or make decisions with respect to surgery. And there are good examples. Like skin cancer has a lot of data on it. I mentioned skin cancer is a good example where there's really high survival rates after early surgical removal. And so, for example, there's like 95 to 99% survival rate at 5 years after surgical removal for these early stage skin cancers like basal cell carcinoma and squamous cell carcinoma. So those are really high numbers, suggesting that, in this case, the tumor is acting as a small localized emergency vault, and removing it eliminates the immediate threat, right? And then for early stage melanoma, it follows similar patterns. Basically, when caught at stage 0 or stage 1, where you have thin localized lesions, then surgical excision alone yields 95 to 99% 5-year survival rates. So once again, really good numbers for stage 0 and stage 1 melanoma for after surgical removal. So yeah, those are really promising. And then with advanced or metastatic melanoma, that's where the disease is widespread, and the body has potentially multiple vaults containing a heavy toxic load, and aggressive surgical removal of the primary tumor doesn't necessarily consistently improve overall survival. So that's where you have to think more carefully. Let's talk about one more example, which is prostate cancer. And I mentioned that prostate cancer provides a little bit of nuance to things because, unlike most skin cancers, many low-risk prostate cancers behave kind of differently, and they show that you get really high survival rates on these prostate cancers just by actively monitoring it and not necessarily cutting it out. They have basically an identical long-term cancer-specific survival compared to those who undergo immediate surgery for 15 years after the fact. So basically 97%. 97% survival rate at 15 years. It's basically similar numbers if you get surgery versus if you don't get surgery for prostate cancer. And that's for people who say don't get surgery but nevertheless still monitor how things are going. So that's suggesting that at least for prostate cancer, there's some stability to the situation. You can monitor it and just check how things are going, and it has some basically stability where it's not panicking. It's like, okay, I kind of have things well contained here. And that suggests that this may be a case in early stage prostate cancer where surgery might not be necessary. So I think that's kind of interesting and provides some nuance to things. All right, so let's just kind of wrap things up. Basically, mainstream theory just says 3 words: cut it out. They just are gung-ho, full steam ahead, get the tumor removed. And the data don't fully support that in its entirety. They do show for things like early stage skin cancer, then yes, surgical removal can lead to good outcomes. But the data for late stage, advanced stage cancer do not support the view that you should always cut things out, because sometimes it can lead to worse outcomes. So the medical data does not fully support the view that you should always cut a tumor out. That's why I'm providing a more nuanced take on things and suggesting that you have to carefully weigh the pros and cons. Think about your specific situation. Think about how your detox organs are doing. And if they're doing well, if your body's healthy, if you're actively on some low toxin diet like carnivore or keto, and you're working really hard to lower your toxic burden, then maybe, yeah, you're early stage enough that you can just, remove the tumor and have it safely gone, and you have enough detox capacity to handle the toxic load that you're carrying. But at the other extreme, if you're still, inundated with toxins and you haven't gotten on a good diet, and your detox organs are failing, then your body's really relying heavily on that tumor as your primary detox organ. And if you remove that tumor, your body's going to be scrambling like crazy to make new detox organs, and you might be getting new tumors in the future. It might not be successful, right? So that's just something to think about. All right, well, thanks very much for listening, everyone. Have a wonderful day.